Hi everybody, this is Dr. A, and I've got an anatomy and physiology review on the respiratory system. So the function of the respiratory system is to inhale fresh air full of oxygen into the lungs and then exchange the oxygen for carbon dioxide and exhale the stale air, which is full of carbon dioxide. The organs of the respiratory system are the nasal cavity, the pharynx, which is basically the throat, the larynx, which is your voice box, the trachea, the bronchial tubes, and the lungs. So the respiratory organs will perform the mechanical work of respiration, and constant gas exchange is essential because if you stop breathing, you don't get to live for very long. The respiratory and the cardiovascular system do work together, though, on gas exchange because gas exchange happens in two locations, as we are going to learn. Respiration must be continuous. Interruption can cause brain damage or death. And respiration is divided into three parts. We have ventilation, external respiration, and internal respiration. So we're going to break all of these down so you know what's going on. Okay, so let's start with ventilation. So ventilation is the flow of air between the outside environment and the lungs. So it's breathing air in. A trick to remember that is that ventilation is while you would put somebody on a ventilator, right? Is to help move that air in and out of the lungs. So as part of ventilation, you have inhalation, the flow of air into the lungs that brings fresh oxygen into the air sacs. And then you have exhalation, which is the flow of air out of the lungs and removes the carbon dioxide from the body. But you also have these two respiration phases of external and internal respiration. And so those are actually the point of breathing, of ventilation, is to get the oxygen in and the carbon dioxide out. Well, the process of getting the oxygen in and the carbon dioxide out at the interface between the lungs and the circulation is external respiration. So in the lungs at the alveoli, and we're going to look at what those are here in just a minute, we have an exchange of oxygen coming from the air in the lungs going into the capillary blood, and then the carbon dioxide that's in the capillary blood diffusing into the alveoli so that you can breathe it out. So these gases will diffuse in opposite directions, with oxygen going from the lungs into the blood and carbon dioxide going from the blood into the lungs. And then you have internal respiration. So the whole point of us getting oxygen into our bloodstream is so that we can deliver it to the cells, because that's where it's needed to create ATP for all the metabolic reactions that happen in our cells. And so at the tissue level, at the cellular level, when oxygen is delivered to the tissue and carbon dioxide is removed, that is internal respiration. So the oxygen will leave the bloodstream and enter the cells of the tissue, and it is used immediately for metabolism. As part of using up the oxygen for metabolism, carbon dioxide is produced as it makes ATP, and also water is produced, but the carbon dioxide as a gas can then diffuse out of those cells and into the bloodstream, and then it needs to be carried back to the lungs so that it can be breathed out. All right, so let's go through the path of air coming in and going all the way to the lungs. So air should enter the nasal cavity at the nares, right here, the openings. And it is divided by the nasal septum, which is your nose bone here. And the palate separates the nasal cavity up here from the mouth. So the palate is the roof of your mouth. The mucous membrane lines the cavity. It secretes mucus. We all know that when we blow our nose or cough. And the point of mucus is to clean the air by trapping particles. The nasal membrane is moist and helps moisturize the air as you breathe in through your nose. The capillaries in the membrane also warm the air as it passes through. So there are also little cilia, which are little hairs that line the nasal opening and filter the air to clean it, along with the mucus. That's where the mucus is also. And then your paranasal sinuses that are on the sides of your nose can aid in sound production and voice resonance, which is also why you always sound different if you're really stopped up and congested. Okay, and so just make a point that this is the way it's supposed to be. You're supposed to breathe in through your nose. Of course, it's hard to do if you're congested, but it is much healthier for you to breathe in and out through your nose, even when you're sleeping, versus breathing through your mouth, because if you breathe through your mouth, then you have all of this process of the air being clean and warm doesn't happen. All right, the pharynx is where the air goes next. So that's the throat. It has both respiratory and digestive functions. It is 5 inches long and is divided into the nasopharynx, the oropharynx, and the laryngopharynx. And I'm going to show you those in a diagram in just a second. The tonsils are located in the pharynx and capture pathogens and they're part of your immune system. And the opening of the eustachian tube is also in the nasopharynx. So that is the tube here that drains your ears into your throat. They're the ones that hurt if you fly also. So here's a diagram. So the nose area here, nasal cavity is here. So the air will enter the nose through the nares, pass through the nasal cavity, and there are folds here that help warm the air that align with cilia and produce mucus. And then the air would go down and hit the pharynx. So the top part of the pharynx is going to be the nasopharynx right here. Okay, then the air would flow down. And then about where it lines up with the mouth is going to be the oropharynx, right here where the tonsils are and the tongue is. And then the air is going to flow down, and then it needs to go over here. And then this is the larynx, and so the part of the pharynx is right above it. This area right here is the laryngopharynx, because it leads to the larynx, which is your voice box, and then down to your trachea, down to the lungs. And then this passageway here, oh, sorry, I clicked on it. This passageway here is the passageway of food. Sorry about that. Okay, so the larynx is your voice box. It's a muscular structure between the pharynx and the trachea. It contains folds of tissue known as the vocal cords, and the glottis is the opening between the folds, and that's air would flow that way. The folds make sound by vibrating as air passes through the glottis, and that's how is part of how we speak. The epiglottis is a flap that lays on top of epiglottis, the glottis, and it closes the voice box, the larynx, and the trachea when you swallow. So it's to prevent food and liquid from being inhaled into the lungs. So it covers the larynx and the trachea during swallowing and shunts the food down from the pharynx down to the esophagus. The larynx is made of cartilaginous plates that are held in place with ligaments and muscles. So there are no bones in there. It's just cartilage, ligaments, muscles. This is what the epiglottis and the larynx look like viewed from the pharynx. So view going down. So past that is the trachea, and that is the opening here. So then the trachea is a tube composed of smooth muscle and cartilage rings. It carries air from the larynx, so with the air that's hit the voice box down to the main bronchi. It is lined with mucous membranes and cilia. They have the same function as they do in the nose, is to clean and trap the air as it travels to the lungs and to warm it also. By the way, smoking is bad for you. In one of the ways it is bad for you is it paralyzes those cilia and then they can't do their job. So it's another reason to not smoke. All right, so there's the anatomy here of the respiratory system. So we had our nose here, nasal cavity, and then we have our pharynx area here, and then air is going to go down through the larynx right here, down the trachea, and then we have our bronchi. So we have some bronchus here, then they get smaller and smaller into the bronchiole, and then we're going to look at the alveoli, etc. This is your diaphragm, then right lung, left lung. All right, so the bronchial tubes are what gets the air after it leaves the trachea. And so the trachea divides into the left and right main bronchi. And each bronchus enters a lung and then continues branching like branches of a tree. The narrowest branches are the bronchioles, and the bronchioles will terminate in the alveoli, and the alveoli are wrapped in pulmonary capillaries, and this is where gas exchange occurs. So the air has to get all the way down to the alveoli to be able to cross into the bloodstream. All right, so here is a representation of your lungs basically, but mostly the larynx, the trachea, and we have the right main bronchus or primary bronchus, and the left main or primary bronchus here, and then we have, for example, here's a secondary bronchus, but so would this. It would be another secondary, so would this, and so would that. And then you have a tertiary bronchus, which is the next branch, so that if this is primary, this is secondary, this one would be tertiary, for example. And then the little bitty ones at the end are their terminal bronchioles. And so this is what the alveoli look like. They look like little grape-like clusters. They're sacs. And they're clustered like this because the fact that they look like grape-like means that there's a lot more surface area, and each of them is wrapped in a ball of capillaries, and they're elastic. There's elastic fibers too, so they can inflate and deflate, inflate and deflate. But this right here, this formation has way more surface area than if it was just one big ball, one big blob there. So lots of capillaries wrap around the alveoli, and this is where gas exchange occurs. So each lung is a total collection of the bronchia, bronchioles, and the alveoli. The lungs are protected by the pleura, which is the lining of the lungs. The outer parietal pleura lines the chest cavity, and the inner visceral pleura sticks to the lung surface. And in between the two, there's some pleural fluid. And the pleura form a sac around each lung, and that's called the pleural cavity. Each lung is divided into lobes. So the right lung has 3 lobes, the left one has 2, and one of the reasons for that is the heart is situated on the left side of the body so that it takes up the space of the 3rd lobe, if you will. So that's why the left lung only has 2 lobes. The superior point of the lobe is the apex. So think of a mountain. The apex would be the top, right? So the lobes of the lungs have this kind of triangular shape. So the top part is the apex, and the wide base, here is the base, the lower area is the base, just like the base of a mountain. And then the medial hilum is where you have the entry and exit points for the bronchi, the vessels, and the nerves. And the ribs protect the lungs and the mediastinum, the heart, etc. So let's talk respiratory muscles. So the diaphragm will produce a difference in atmospheric and thoracic pressure. So that is how it pulls air in. When the diaphragm contracts, it goes down, right? And that increases the thoracic volume and decreases the thoracic pressure, so that the thoracic pressure, the pressure inside the thorax, is lower than the atmospheric pressure, and the air would flow from the outside into the thoracic cavity. And until the pressures are equal, the atmospheric pressure is equal to the thoracic pressure. And the diaphragm is assisted by the intercostal muscles, where they can further enlarge the cavity of the ribs, the thoracic cavity. And then when the diaphragm and the intercostals relax, so when it contracts, it goes down. When it relaxes, it goes back up. Then the thoracic cavity becomes smaller, the pressure increases, and it pushes all that extra air out in an effort to equalize atmospheric and thoracic pressures. So unforced breaths are passive, and forced breaths are active. So the respiratory rate is the number of breaths per minute, and is one of the vital signs that is taken to assess patients. And that respiratory rate is regulated by the amount of carbon dioxide in the blood, and also by the pH of the blood. And when the carbon dioxide level is high, the breathing is going to be more rapid to expel the waste. Just think if, for example, when you exercise or you run, your metabolism is faster because you're using up a lot of energy, and so you're creating a lot of using up oxygen, create a lot of ATP to make a lot of carbon dioxide. So carbon dioxide builds up, and you start breathing faster. And that's just to get the excess carbon dioxide out. As the level drops, the carbon dioxide levels drops, your respiratory rate will decrease. And if you have an altered breathing rate, especially if the person has not been doing exercise or anything, then that can signal problems. And lastly, let's talk about lung volumes and capacities. So these are things that can be measured to assess lung function. They're measured by your respiratory therapist. And so for certain conditions, it's important to measure the volume of air flowing in and out of the lungs. This can help diagnose conditions such as asthma and COPD. These measurements are used to determine the lung capacity, and a respiratory therapist will measure these lung volumes using a pulmonary function test. This is also really good to track therapy for somebody, for example, that has asthma or COPD, to see how well they're managing and how they're doing over time. So let's look at some of these volumes and capacities that can be measured. So the tidal volume is a volume of air that moves in and out of the lungs in a single relaxed breath. So your normal everyday breathing without any extra effort, that amount of volume that comes in and out is your tidal volume. So I want to pause here for a second and I want you to think this is not the same for everybody, because it depends on your size. And so just for illustration purposes, you could imagine the tidal volume of a little bitty infant is not going to be the same as that of an adult. And so if you were to ventilate for them or bag them in a code situation, you want to push a lot less air into a little bitty baby than you would into an adult. So that's an illustration, if you will, for tidal volume to kind of get your mind around that. Your inspiratory reserve volume is the volume of air that can be forcefully inhaled after a normal inhalation. So if you breathe in normally, it's the inspiratory reserve is how much more you can breathe on top of that. Breathe in. So instead of just a normal breath in, you would go. That would be the extra on top of the tidal volume is your inspiratory reserve. Your expiratory reserve is the volume of air that can be forcefully exhaled after a normal exhalation. So if you normally breathe out, then what you can do basically to empty your lungs is expiratory reserve. So the residual volume is the volume of air that remains in your lungs after a forced exhalation. So you can't completely empty your lungs, so there's always some air left in there. The inspiratory capacity is the volume of air inhaled after a normal exhalation. So that would be your tidal volume and your inspiratory reserve. So you would breathe out, and then you would try to breathe in as much as you can. So if you measure that volume of air moving, that's your inspiratory capacity. Your functional residual capacity is the amount of air that remains in the lungs after a normal exhalation. Okay, so if a normal breath out, that's your functional residual capacity. The vital capacity is the volume of air that can be exhaled after a maximum inhalation. So it's equal to your tidal volume, your inspiratory reserve, and your expiratory reserve. And so the way you would measure that is you would try to breathe in as much air in as you can, and then breathe out as much air as you can. And that would be your vital capacity. And then your total lung capacity is the volume of air in the lungs after a maximal inhalation. So it's how much you could hold into your lungs, and it also takes into consideration your residual capacity. So illustrated here in a graph, you have your normal here everyday breath is your tidal volume. Your inspiratory reserve is what you can breathe in on top of your normal volume. Your expiratory reserve right here is what you can breathe out on top of a normal breath out. This right here is your residual volume, is what is the amount of air that's still in your lungs, even after you breathe out as much as you can. And then your vital capacity would be however much air you can breathe in with however much you can breathe out. So that's your vital capacity. but your functional residual capacity here is going to be what's left in the lungs after a normal breath, and your total lung capacity is your residual volume plus your vital capacity. So that's your total lung capacity. And then your inspiratory capacity is how much you can inhale with a normal breath and extra. So it's the normal breath plus the extra inhale. And your expiratory capacity is I'm trying to see, they don't have it here, is the normal expiration plus the extra. So there you go. So that hopefully kind of helps you illustrate. And all of these can be measured and taken into consideration to help determine if a person has problem breathing air in, getting air out. So that would be the difference between asthma, you have trouble getting air in, COPD, you have trouble getting air out, and how much, etc. And so this can be very valuable. So sorry, this is a little bit lengthier lesson. I hope this was helpful for you, and I have more to come.